Yo. Uh-huh. Yeah. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel.
Dr. Goodman, welcome
Howdy,
back,
howdy.
Casey. What's going on?
Not much, man. Just having a good day after our bike ride. Feeling good.
Long time no
Finally
see. Yeah.
finally got back out there, so that felt good.
So, Casey, today on the podcast, I want to talk to you about testing our blood and all of the labs and tests we can start doing and track to help save our lives. And one of my favorite quotes, Charlie Munger, he passed away, but he was, who Warren Buffett is, the famous investor from Omaha. Well, they were partners, and Charlie was this very wise attorney. And one of his quotes that I really liked is, all I want to know is where I'm going to die, so I'll never go there." I think that's like it's relatable to our blood and testing for preventative disease and things like that. I took a look at all of the top killers of men as we age, and not to be morbid, but in the vein of trying not to go to the place we're going to die, the number one killer of men is heart disease. According to ChatGPT, that's 20% of all men's death. Number two is cancer, and that's 17% of all men's death. And then after that, it's unintentional injuries, accidents. That's not something that you can really do much about when we're talking about health and prevention. Maybe you can. You can teach me. We'll see. And then stroke, it's about 4.7% of adult men die from a stroke. And then respiratory disease is 4.1%. And then Alzheimer's disease and or dementia is the next one. And then so on and so forth. It goes to diabetes and then liver disease. So what I want to do today is get your opinion on some of the blood tests we can do, and we can start asking our doctors for as we start aging and start tracking over time. I want to talk first about heart disease because, like I said, it was the leading cause of death in all men at 20%. So we can start with that one, but then we can kind of move on to some of the other killers in men. And I want to get your take on what we can do, what we can start testing for, which blood labs we should talk to our doctor about. So could we start with the heart disease?
Yeah, sure. So I think it's important to state that it's not so common that you have like a single blood test for a single disease or even a single blood test for a single organ. Many of the chemicals in our body are found like in various tissues. And so when you're measuring your blood tests, there are some that are specific to like you can get your kidney function tested, and it's not like you're going to confuse it too much with like your muscle or your gut or something like that, or your liver. There is some crossover, like you can have elevated creatinine because you have rhabdomyolysis or muscle breakdown, and that can be like, oh man, but that can essentially lead to kidney failure. So, it all kind of it can blend in some
That
ways.
makes sense. Yeah, you test it, and then that could lead to a bunch of different other things.
Yeah. And so you just got to be careful that we don't try to get too like simple with this stuff. There's a little bit of nuance to it, and there's definitely interpretation. So you should have, your healthcare provider going over this stuff with you. So you shouldn't just go and get your blood drawn and then just look at it and go, "Oh my god, like this level is off. That means my liver sucks, and that means I need to go take holistic compound," and you start pounding supplements thinking you're doing the right thing, but maybe you're just exposing yourself to side effects from certain substances that you may have avoided if you just had a doctor that said, don't worry about that. That can be elevated for a number of reasons.
That's a pretty good disclaimer. But with that said, could we try to simplify it as much as possible? Even if, listen, I know it's complex and we're not going to get it down to, hey, this measure is going to cause this, but as much as we could to try to help
Yeah.
understand it.
Yeah. So, in that spirit and with that disclaimer, when we talk about heart disease, what I would boil it down to as best I could is inflammation and atherosclerosis. So, what is inflammation and atherosclerosis? Atherosclerosis refers to the buildup of cholesterol in the walls of your blood vessels all through your body. And so, that, and cholesterol buildup and fibrotic change in the walls of your like blood vessels. So it's like a thickening, a hardening of the walls of your blood vessels. So many things contribute to atherosclerotic development, and that includes inflammation. So inflammation very generally in a little small doses is a good thing. When you have an injury, you want your inflammatory response to send a bunch of fixer blood cells and chemicals to the site to begin to repair damage. Or
Is that why they'll do like microneedling or like shock therapies to like repair things?
yeah, it's kind of like taking advantage of your body's natural repair response, which is part of the inflammatory cascade. But, if you get sick, your body stimulates a response to fight off, your cold or your flu or your whatever it is. And so a little inflammation is a good thing, but a lot of inflammation and sustained inflammation can be detrimental to your body. So yeah, microneedling or those types of procedures are taking advantage of your body's natural inflammatory cascade. It's a repair pathway. We create an injury, the body stimulates its inflammatory repair response, and you get regeneration of certain cells. And, that's probably kind of the strategic use of it. So a little bit of inflammation is good. You're going to fight off a cold or a flu. You're going to fight off diseases. But a lot of inflammation or a little inflammation for too long a time, for a sustained period of time, is going to increase fibrotic and atherosclerotic change in your blood vessel walls and in the tissues of your body. And the best way I can describe it, please don't hold me to this metaphor because it's overly simplistic, but if your blood vessels are the plumbing in your body, right, they're the pipes, then too much pressure in the pipe could erode the pipes over time, or the wrong chemicals in the water rushing through the pipe could maybe cause eroding or disintegration of the pipe. You have to take care of the integrity of the pipes themselves. You don't want them to get too leaky. You don't want them to be not leaky at all. We know sometimes especially in our blood system, we want stuff to sort of flow in and out of our bloodstream strategically and for our best use. And that's how the body works. It's a beautiful, complex machine. But sustained inflammation or a sustained inflammatory response over time will lead to atherosclerotic buildup, so buildup of cholesterol, fats, and lipids in the walls of your blood vessels, and fibrotic change in the walls of your blood vessels, so it makes them more rigid. They can't bend and stretch like they used to, and stuff doesn't pass over the walls like oxygen or other nutrients like it used to.
Is
So
that what fibrotic change means? Just the
yeah.
hardening? Okay.
Yeah, so fibrosis is just like a buildup of collagenous proteins and other stuff in the tissue when you don't want it there. So fibrosis, I'm sure, in small doses and in certain places has its appropriate function, but too much is not good. And
Gotcha.
so when we talk about heart disease, the driving factor of heart disease will be that inflammatory change, the fibrotic change, and the atherosclerotic change in the vessels of your body, and then that it will extend to the tissue of your heart. So if you have too much atherosclerotic buildup or your blood pressure is too high for too long, then the tissue, the muscular tissue of your heart will literally become less stretchy. It will become more fibrotic. It will thicken over time if your like blood pressure is sustained for a long time. And those changes will lead to compromise of the function of the heart. With each beat, maybe less blood shoots out each time. Maybe the heart gets too stretched and it kind of balloons a little bit. And again, it just all affects the function of that pump. That pump is, it needs to stay in a certain window. And when you have chronic inflammation or atherosclerotic change, you're going to affect how that pump behaves. Not to mention that you have electrical wiring all through your heart. Your cardiomyocytes, the heart cells, they're electrical conductors. And so you have these pathways through the heart muscle cells. The cells themselves will conduct electricity, and that tells your heart how to pump, right? It stimulates the contraction and it has to be coordinated in a very specific way. So if your muscle cells in your heart are all of a sudden compromised, they're big, they're thick, they're atherosclerotic, there's fibrotic change, whatever the case is, that electricity doesn't conduct quite as well. Or maybe there's a part of your heart that gets overly excited and you have this rogue electrical stimulus from another part of your heart and now you have an arrhythmia. And so to prevent heart disease or to get ahead of it early, I think is really to look after the inflammatory level in your body, the level of inflammation in your body chronically, and to try and keep that to a dull roar as much as possible. So
Inflammation, that's the most
inflammation,
important.
yeah. So when we talk, it's overly simplistically, I say inflammation is the enemy, right? Anything we can do to lower the amount of inflammation in our body generally is going to be better for you. It's going to
What inflames us?
so chronic disease inflames you. External disease inflames you. So if you get sick with the flu, your body's going to stimulate an inflammatory response. So if you had a new virus every single week of your life for the rest of your life, you'd be inflamed all the time. You'd be sick all the time. You'd be running fevers all the time. And you'd probably take some anti inflammatory medication like Motrin or something to get the fever down, right? You're taking anti inflammatories because you just want to feel better while your body tries to fight it off. So, our diets can be inflammatory. I'm not a dietitian. I couldn't go into the specifics of which diets are generally more inflammatory than others. There used to be a general, like, oh, if it's a high glycemic index diet, certain diets will spike your blood sugars, and dealing with your blood sugar is, like your body's trying to deal with it and trying to lower your blood sugar levels can be like an inflammatory response in and of itself. So diet is a big one. External factors like smoking, alcohol use, lifestyle factors contribute to inflammation in our body. So when we're talking about, again, intervening on something like heart disease, we're really talking about intervening on inflammation and atherosclerotic change in the body. So what exactly do you test? Well, the most direct test would be probably your lipid panel. So these are your cholesterol levels in your blood. And cholesterol is the way that lipids or fats are kind of packaged and float around in your bloodstream. And then they get stored as well in the liver and in other tissues. And in fat in your body, right? You've got fat everywhere. So it gets stored, but there's little bit of it circulating in your blood, and your body will grab it and deploy it as it needs to for a certain, biochemical function. But those cholesterol levels, they come in different types. There's low density cholesterol, which is larger particles, and the lipids are not as tightly packed. So it's kind of, you can imagine they're easier to grab at, easier to flake off. It's a little more sticky, maybe. And then you have these high density or tightly packed cholesterol packets, and that's your high density lipoprotein or HDL cholesterol. And that one, also serves a function, but it's tighter packed, right? It's not as sticky, it's not as flaky, whatever. So generally speaking, higher LDL levels are associated with more atherosclerotic change or cardiovascular risk. So you want to keep the balance between your LDL and HDL, a little bit lower LDL. We want to see a little higher HDL if we can. I don't think either of them on their own are like, oh, that's horrible. We got to change that. But if your LDL levels are generally a little too high and your total cholesterol levels, even if you just looked at total cholesterol, if it's a little too high, like above 200 and certainly into the 3, 4, 500, 600s, then you're just going to want to get those down. You want to get them to a more healthy level.
Do you add those numbers together?
I don't really know how they add them all together, but I think total cholesterol is essentially the addition of, LDL, HDL, and maybe VLDL, very low density lipoprotein, and maybe there's a few others that are thrown in the mix too. But when it comes out on the lab report, I see total cholesterol, and then we usually see HDL, LDL, and VLDL.
HDL, you want higher, correct?
Generally, you don't want a higher level. You just want it to be at least, I think it's like above 50, 50 to
About
60 or so.
50?
So you want to, if that's really low, like let's say it's 20 or 15 or whatever it is, then you go, hey, my HDL is not quite where I want it. I want it to be a little higher. And then your LDL is probably always going to be a little higher than your HDL, but you just want to keep it within the realm of like safe. And so over the years, the scientists have come up with these levels, where we want to keep total cholesterol below 200 and we want HDL around 50. And, that's just kind of the general guideline. I'm sure there's some stats out there that you could look up where it says we see a significant increase in the rate of heart attack and stroke with a total cholesterol level above this number. And so people in the primary care community, we start testing around the age of 40 or so, from between the ages of 40 to 75. We test lipids, but we test it in order to see whether or not someone would benefit from getting on something like a statin medication or taking a daily baby aspirin. Because what
And what
they
does that do?
so what the so a statin medication, they're called HMG-CoA reductase inhibitors, and that is to prevent the formation of the cholesterol. It's just part of the synthesis of cholesterol. And so the numbers show that with higher levels of cholesterol, the incidence of cardiovascular insults, so like a heart attack or a stroke, goes up. So these guys say, hey, look, HMG-CoA reductase is responsible for building cholesterol. Let's inhibit that enzyme and get these cholesterol levels down and see what happens. So I've heard both sides in my training as I came up. Some people were, the community I feel like is always going back and forth. Like, we treat to a target cholesterol level. This level is what we want to get you to. So you need to go on a statin to get you to that level.
And that's 200?
Yeah, well, that's total cholesterol. Yeah. And then there's other numbers for like LDL and HDL. But then, for a few years there, they were saying, look, there's actually no target cholesterol level that we need to get you to. However, we do know that if you're taking a statin, the level of heart attack and stroke is down. So whether or not we get your lipids down, you're having less heart attack and stroke if you're taking a statin. So they were like, maybe it's not just the cholesterol level that comes down. Maybe the statins are kind of anti-inflammatory in another way, and they don't just affect your levels. They actually improve inflammation or, improve fibrotic change in some other way. And then they'll go back and say, no, actually, we do want to target like a certain level of cholesterol. But all that to say that statins or aspirin is a tool that healthcare providers will use to try to, generally speaking, lower cholesterol levels and prevent inflammation, prevent inflammatory change and fibrotic change over a long period of time. And by doing that, they prevent incidences of heart attack and stroke.
Yeah. Casey, what do you think? Is this something that, a baby aspirin or a statin, my family has a history of heart disease. I told you my dad had a heart attack. My grandpa, I know, had some heart complications. When I get my levels tested, my cholesterol is pretty good, I think, in general. Would you still recommend it for someone like me, even without, those elevated numbers?
Yeah, I think it's very much something you should consider because I would be curious to know like what your dad's cholesterol profile looked like what his lipid profile looked like and a few other things, but especially in folks that seem healthy and their lifestyle factors are pretty healthy and maybe their lipid panel looks normal and they still suffer from heart attack. That's someone where you say, well, maybe there's a genetic component to that. Maybe there's some other thing that is contributing to atherosclerotic change in my body that I can't do much about because it's in my genes. And maybe I should take a statin to try and prevent some of that inflammation from happening. And that is something that I think there is a significant proportion of the medical community, at least like what you might call like the modern allopathic medical community, that would say, yeah, I would take a statin because the side effects are pretty minimal. They do happen, they do occur, and you got to watch for them. But for a lot of the medical community, taking a statin is kind of like, look, this is like a multivitamin for a lot of us, and like the benefits greatly outweigh the risk of taking this extra thing.
Gotcha.
So yeah, it is something that I would just consult with your doctor about. And if you're worried about it, then, try a statin for a while and see if it, hurts your muscles or see if you suffer from some ill effects. But it could be something that would benefit you.
Yeah. What about triglycerides? I know when they do the lipid panel, that's something that comes out as well.
Yeah.
What is a triglyceride, and tell me more about those and where those levels should be?
Yeah. Triglycerides are another, I would say, indicator of the potential for fatty buildup or atherosclerotic buildup. So triglycerides are how your body packages and then begins to store lipids or fats. Okay, so it just kind of takes these fatty acid chains, puts them on a glycerol molecule, which has three prongs, and they go into these big long chains off the glycerol backbone or the molecule there. So if those are floating around in your blood in high abundance, I feel like that's even more. It's just another independent risk factor for atherosclerotic change and inflammatory change. So we're probably going to get into the weeds a little bit too much. So I hesitate to kind of go too far off, but just suffice it to say that when you have lipids floating around in your bloodstream, lipids are also what make up the membrane of your cells, right? You hear about the lipid membrane of your cells.
Mhm.
And so they perform a vital function for your body. Your cells are made of them. But you also have in your body these what's called reactive oxygen species or free radicals. And we can get into generally speaking like where those come from, but it's very generic, so there's not a lot of specifics to dive into there. However, just suffice it to say that with the normal functioning of your body, you have free radical formation and you have some external factors that can increase free radical formation. But these free radical guys, they're nasty little buggers. They're basically these reactive species that have like a free electron kind of hanging out on, attached to them. And they can come in and react with the lipids in your body, the lipid chains. And it will change it in such a way that it makes it unstable. So you might have a lipid that encounters a reactive oxygen species. All of a sudden, that lipid has a hydroxyl group on the end of it now. And that means that another lipid that comes along can get changed by that hydroxyl group. And then the next one next to it can get changed, and it starts this sort of chain reaction. It's called lipid peroxidation. And that change in chemical structure of your lipids will affect the integrity of your cell membrane. It will be broken down further into damaging molecules like certain aldehydes and other alcohols. And so you want to avoid that. You want to diminish the amount of, you don't want lipids floating around in your bloodstream because then you have a higher likelihood that they'll encounter one of these reactive species, change conformation, and be broken down into a damaging molecule or start a chain reaction that affects other lipids in your body. So I think more of biochemistry is like almost like a game of probability. It's like, look, we don't hate lipids, but if all you got is lipids floating around, then you're 100% going to have a lot more lipid peroxidation that happens because they're going to find all the
Mm.
free radicals that are floating around before they can get, knocked out by a glutathione molecule or something. And they're going to change conformation and they're going to be broken down into bad stuff. So we just want to limit that. So we want to keep them at this certain level, right? And the statistics show over time as we study population health that, hey, if it looks like this little window down here, this level means that there's less heart attacks, that there's less obesity, that there's less metabolic syndrome, that there's less
Mhm.
of these other things. So it's more reactionary and like probability and statistics based, I think, than we want to admit. But yeah, that's like a very long answer to like
Yeah,
why triglyceride levels are important.
that makes sense. Casey, I think we got into the heart disease and talked about the blood there. Anything else that should be tested? We talked about, cholesterol, HDL, LDL. You said VLDL. I asked about triglycerides. Anything else for your lipid panel?
No, I'd say in terms of like heart disease, that's the main one. You want to get the lipid panel, get your triglycerides, total cholesterol, LDL, VLDL. And that's the main contributor I think that I would.
And at what age should men start testing their blood?
I think if you're aggressive and you're worried about it, your mid 30s is probably a good time to start getting some baseline levels. At 40 is kind of when your normal primary care doc would probably pull you aside and say, hey, we need to get your blood and start checking your lipids every few years, every 3 to 5 years or something like that. And it also depends on your risk factors. If every single male in your family struggles with heart disease and has heart attacks and all that stuff, then at around age 30, they'll probably be like, hey, maybe we start testing you. So that's probably a good time to start thinking about it. It's like in between 30 and 35, take a good look at your lifestyle, take a good look at your family. And if you're eager, then ask your doctor about getting the lipid panel done.
What are the risks of not checking your blood regularly once you hit 40?
I think the risk would be in certain populations, you might miss the opportunity to prevent, a heart attack or two or a stroke or two. So if you're someone who's got a lot of family history of cardiovascular illness and you just don't think to check, well, then you're probably not going to intervene. You're not going to take an aspirin. You're not going to take a statin. You may not change your lifestyle if you need to, right? If you are sedentary and you need a little kick in the pants to start exercising and living a healthier life, then getting a lipid panel might be that kick in the pants. The doctor might say, hey, dude, like, your triglycerides are off the charts, dude. Like, we need to
Mhm.
get these down. Are you doing any exercise? What's your lifestyle like? And if you're really, really healthy, you're like, I run every day, I do all this stuff. He might say, okay, well, then I need to give you a medication. I need to get you on a statin or another one of these triglyceride lowering medications to get that down because your risk of heart attack and stroke goes up as these numbers remain elevated. So it's the opportunity to intervene that you miss out on, really.
You see, well, we've talked about heart disease and the lipid panel we should do. The second highest killer of men is cancer. And that's about 17% of men, according to ChatGPT. Are there any blood tests that you would recommend for cancer?
Probably not. Uh, the reason why is that there's really only one preventative blood test for like a cancer in males, and that's probably the prostate specific antigen. And even then, the general recommendation right now is that like at age 55, in between 55 and 70, you can get a PSA level if you would like from your doctor. The caution in the medical community right now is that if you get the PSA level and it's high, it can lead to further testing, which could be as aggressive as like a prostate biopsy. And, the rate of prostatitis or other things as a result of biopsies is not zero. So there's just a bit of like a balance for over treatment or over diagnosis. So there's just a little bit of a caution there. But the PSA level, if you were kind of like looking for one, that would be it.
Okay. So PSA level for prostate, if you wanted to do that, but for cancer, you're not testing your blood, you're doing different kind of like MRIs or different kind of things.
So there are blood tests for cancer, but they're not typically done as like a routine preventative measure when
I
you
see.
turn 40 or 45.
Okay.
So if you start to have like a bloody cough or you're really short of breath, they're going to do a chest x-ray, they'll probably do a CT scan, and they may see like a nodule. They'll go in and they'll probably get a biopsy of that spot, but they'll also do a blood test and they'll test you for certain antigens and certain biomarkers that are consistent with certain types of cancer, because certain types of cancers do put out different chemicals into your blood. But that's used for diagnosis usually more than prevention. So the only one that I know of, and I'm sure that there's stuff coming down the line for this, honestly,
Ah,
is the PSA level.
gotcha.
I suppose if you really wanted to get into like the weeds on it, some of the other inflammatory markers in your blood that we could test for, like CRP or, something like that. If those are high, I think it could sort of send you on a little bit of a journey where you're trying to figure out, like, why is there a low level of inflammation in my body? Maybe it's because you've got a little cancer that your body's trying to fight off in its the early stages and you have nothing else that would account for that inflammation in your body. But again, you kind of risk the wild goose chase. And then,
Hmm.
what are you going to do every time you get a high CRP? You're going to go get an MRI and make sure there's no small cancer that you can see or something. It's kind of like it's a little bit of a slippery slope and not sure that's something that's really beneficial for you in the end. But
Gotcha. Okay. Well, the next one is unintentional injuries, and 6.5% of men die from that. What are the blood tests there?
I don't think there's a blood test for stupidity. I think,
No.
or maybe not just stupidity. I don't think there's a blood test for being accident prone. So unfortunately, you're left to the fates on that one.
Okay. Well, what about stroke? Stroke's the next one down. That's almost 5% of death in men. What can you test for if you wanted to prevent stroke?
I would lump this in very much the same with like the heart disease, because heart attack and stroke are pretty much under the umbrella of cardiovascular health and illnesses. So the lipid panel is obviously something that you would want to get done to look at your risk factors for stroke, but also things that overlap with like your metabolic health. So I'm sure, later on down the list, you get to things like diabetes and metabolic syndrome. The reason that diabetes is so concerning for a lot of folks is because it increases your risk for cardiovascular disease. It also increases your risk for a myriad of other things. Again, overgeneralization here, but the reason it does that is because it affects the cardiovascular system. You have too high of glucose levels, and those can get into your cells and kind of supercharge artificially the delivery of glucose to your mitochondria, and that stimulates the mitochondrial membrane to start producing ATP. And when the machinery is running, you're naturally going to have reactive oxygen species and other free radical formation, and that's just a normal side effect. As these machines in our bodies run, there's going to be some leakage of electrons from those processes and leakage and reactive oxygen species running around. And the higher and faster you run these machines in your body, which you might just maybe call inflammation, right? Just that churning and burning, the go, 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 then the more of these reactive species you're going to generate. And those things go in and they oxidate your lipid membranes and they hurt the inner lining of your blood vessels and all that stuff. And so all that over time contributes to, again, inflammatory response, fibrotic change, atherosclerotic change, and It just so happens that diabetes can do that in your kidneys, in your retina, in your brain, a whole host of other places. And so, again, it's just another risk factor you got for stroke. So I would say that, the lipid panel for sure for stroke, testing for the other things that generally cause inflammation or can detect inflammation is another one. Specifically for stroke, too, I think, and cardiovascular health or things, brain health, I think it's worthwhile talking about the polyunsaturated fatty acids, the omega 3s and omega 6s in your body. These perform a vital function for us, and omega 3s are generally protective, they're generally anti inflammatory. The omega 6s perform a vital function in terms of like cell structure and stuff, but in too high amounts, they can be detrimental to your health and they can be pro inflammatory and all that stuff. So it's worthwhile mentioning them, and you can test for those too. The
Just
polyunsaturated fatty
omega-6
acids.
or omega-3s?
Omega-3, so it's omega-3 and omega-6. They can do the testing in various different ways. One of them is like a red blood cell membrane test where they actually look at the ratio and the total amounts of omega-3 and omega-6 fatty acids in the membrane of your red blood cells. And that's kind of like the hemoglobin A1C, which we can talk about uh, of your of your lipids, your polyunsaturated fatty acids. It kind of shows that over time, what chronically does your polyunsaturated fatty acid levels look like? Are you chronically too high in omega 6? Are you doing well? And vice versa. So that's another test I would throw in there for like stroke risk.
Okay. Can you explain to me, like I'm a 5-year-old, what a stroke is?
Yeah, sure. So stroke is essentially a heart attack in your brain. It's a period of time, whether short or long, where there is not oxygen delivery to the brain cells. And those cells then begin to undergo damage and sometimes die. So, in the same way that you have a heart attack, where you may have a blood clot that blocks an artery, and then the portion of the heart muscle that that artery supplies dies or gets injured pretty significantly. Same thing in the brain. Most commonly, we have clotting strokes and bleeding strokes, or ischemic strokes and non-ischemic strokes, where like a blood clot may break off from like your leg or your lung or whatever it is and slide up into your brain and it gets stuck, and then the tissue beyond that blockage isn't getting blood flow, so it's not getting oxygen, it's not getting other nutrients, and it will then be damaged or die. And so whatever functions that part of the brain performed, whether it's moving your arm or moving your vocal cords or whatever it is, it could die out. And so now all of a sudden you have people with stroke that can't move certain parts of their body, can't speak, can't swallow. Maybe it hits the frontal lobe and all of a sudden their personality changes. Maybe it hits certain parts of their brain that affect memory and cognition, right? So stroke can appear in a myriad of ways and look a lot different for each person, but that's the general gist of what a stroke is.
Can I tell if I look at someone, how could I tell if they are having a stroke?
The early signs of the stroke are things like uh, facial droop, like on one side of the face, blurred speech because of that, and the speech muscles, you're not able to speak as clearly as you once did. And so if you see someone that has like a unilateral deficit of any kind, like if it's all of a sudden like their left side just kind of gets into an awkward position and kind of looks like it's not moving anymore, or left side of the face and stuff starts to droop, you should get immediate medical attention.
I gotcha. Okay. Would the same thing like a statin or a baby aspirin help out with prevention from a stroke, or is that just for a heart attack?
No, yeah, it's a stroke as well. So any of those cardiovascular insults that are generally caused by atherosclerosis, fibrotic change, or blood clot formation are going to be helped and reduced by things like a statin or a baby aspirin. A baby aspirin, the way it helps you is to reduce the ability of the body to form a clot, right? For things to get sticky. So that's how it helps you to prevent heart attack and stroke. The statin is less clear. We know that it lowers your cholesterol levels, and we think that it may have some anti-inflammatory contribution, but that one's more like, I think of the statin as preventing the blood vessel itself, like the literal pipe, from becoming stiff and fibrotic. And so if all your blood vessels were suddenly super stiff, fibrotic, and not healthy, there's not going to be a lot of oxygen delivery across the membrane. And so that's essentially what happens in a stroke, right? If it's a mechanical block and no blood flow, no oxygen's getting, that's the same as if you walled it off and there's just no oxygen delivery to the tissue. It's just a little more broad per se. It's not so localized.
Which one's better, a statin or an aspirin if you want to prevent?
Oh man, I don't even know that I could say there's one that's better. I would say they're both. I'd probably have to like look up the actual statistics on which one prevents more heart attack and stroke. I think their evidence is good for both. That they're good for prevention. Yeah.
Okay. What about like dementia, Alzheimer's? First off, is there any blood markers that are early indicators of cognition decline?
Yes and no. So I would say, like, again, with dementia and cognitive decline, if you have really bad blood vessels feeding your brain, if they're atherosclerotic, if they're fibrotic, then you have a greater incidence of cognitive impairment and dementia. Alzheimer's specifically, um, there's lots of different theories as to what causes it, but the most prolific are things like the beta amyloid plaques, the neurofibrillatory tangles that develop in the brain. And so for dementia in general, I would say if you're staying on top of your like cardiovascular health game, then that's one of the best things you can do for the general population, right? Gen pop,
For dementia?
to prevent dementia or cognitive decline generally. If you want to talk specifically about like Alzheimer's, then I wouldn't just say for the general population of the world to go get tested for your levels of beta amyloid plaque or your tau protein phosphorylation. So, but if you have a high incidence of dementia, and particularly Alzheimer's dementia in your family, and you think you're particularly at risk, then I would say, yeah, it might be worth your while to go get some genetic testing done. And specifically in the blood, they can test for the levels of these plaques. They can test for it's called phosphorylation of your tau protein, which contributes to the tangles.
Sure.
There's a couple other proteins and filaments, protein filaments that they can actually will show up in your blood if the level of the plaque is too high in your brain. And so that though is only I think helpful if you have a high suspicion that you're headed down that road. There's that pretty well known documentary that Chris Hemsworth did, where he like it's I can't remember what it's called, but it's like something about longevity and health and stuff. And I think he had that in his family, and so he went and got it done, and like found out in real time on the documentary that he had like the genetic propensity for it, and like two copies of the gene or something like that. So he was like, that affected him quite a lot because now all of a sudden he knows that the likelihood of him developing Alzheimer's or developing dementia is significantly increased. And that can really affect how you live your life, what decisions
Of
you make,
course.
things like that. But
And what can you do then?
that's not necessarily something I'd recommend for the general population if you don't have that like, risk factor.
If you do have family history and you're concerned about it and you go get this test and it says, "Hey, you have a higher propensity of this disease," are there things you can do? Is there any prevention? Is there any cure?
Well, so they're actually, yeah, so we do know risk factors related to dementia formation. And like some of them are as simple as like the air you breathe. Like if you're in a level of high air pollution, you have a higher likelihood of getting dementia and getting Alzheimer's dementia. Smoking is another one. That's an easy fix, right? There's a few others, but there are neurologists that I have worked with who have specialty clinics, and they're usually um, running like an experimental study where you can go and get tested for the plaque, and they can do imaging to see if they can see the level of the plaque in your brain. And then they do have treatments to break up the plaque. So his contention was that if we catch these things early enough, the plaque is kind of like um, the way he kind of described it, this neurologist that I worked with, is that there's sort of like a tangle around the neurons in your brain, which, if allowed to grow too much, will kind of put it in a chokehold and begin to suffocate the neurons in your brain. And so it's not like you get the plaque and all of a sudden that neuron just immediately dies and now you have Alzheimer's. It's really more a matter of time and extent. So if you can get it early and you got some plaque formation and then you go and blast those plaques and reverse plaque formation, his contention was that the function of that neuron could be brought back. And so maybe if you have very mild memory deficits or very mild effects, we could blast away some of this plaque and possibly get some of that function back and most certainly prevent the decline. But that's the only treatment that I've been made aware of.
How does he blast the plaque?
Man, I couldn't tell you. It's some medication that they put on and or they put you on, and it is shown to reverse plaque formation. And so they do brain scans before and brain scans after, and they see a reversal of plaque formation. So they can get rid of the plaque. But if you wait too long, you can't just go take Alzheimer's patients that have severe Alzheimer's dementia, put them on
Yeah,
this
yeah.
medication, take away all their plaques, and give them all their function back. The brain cells, they're gone. It's died. So you have to intervene early, but it's really more of a preventative thing. A lot of these medicines that, in theory, would be effective for prevention, it's hard to get them approved. You gotta have good data. You've got to find people that are high risk. You've got to find people that are high risk that actually have the plaque in small enough amounts that you could show a benefit, like you've got to catch the right people at the right time in order to take that information to like the FDA or these other organizations and say, hey, look, like I'm making a difference here. And then they'll probably come back and say, we need more numbers, like we need more people. And then it's like, okay, well, crap, like how are we going to do this? And so it's really difficult a lot of times to get these experimental medications studied well enough to get them approved. So a lot of times it's like, if you happen to know a doctor that's chatted with a neurologist like I have, who can tell you that, hey, there's this clinic, a few counties over that will actually do this. Why don't you go and get it assessed and see if you're a candidate, for this experimental treatment? But nothing for like Gen Pop, like I would say, that we can just,
Yeah.
oh yeah, go and get this test done, this kind of thing. It's really a more individualized situation than that, depending on your family history and other risk factors.
What we were talking about statistics. Give me the probability we can get that guy on the podcast.
Man, actually, he was a pretty nice guy. He might be into it. I would give it a strong 18 to 22%.
There we go. There we go.
That's statistically insignificant, I would say.
Okay, talk to me about liver disease. What is liver disease, and what are some tests we can do for that?
So, liver disease, I guess you could say, there's several different types. There's like fatty liver, right? So if you have high cholesterol, you're eating lots of fatty foods, your triglycerides are sky high for a lot of years, you're gonna develop a fatty infiltrate in the liver tissue. Like there's just literally gonna be fatty deposits within the tissue itself.
Is
And
that common?
is that common? Yeah. Especially in America, with our diet and our obesity epidemic, it's quite common. You also have, just general liver disease, I suppose. You can have alcoholic liver damage, right? That progresses to liver cirrhosis. And then, yeah, I mean, there's a couple different ways that it can be damaged, but the liver, broadly speaking, is like a detoxifier in your body. It's essential for the breakdown of a lot of different chemicals, what we just generally refer to as metabolism, right? So there's certain things that you put into your body or that your body generates that are broken down specifically by the enzymes in the liver. And then it also stores glucose for you, right? Glycogenesis and gluconeogenesis is performed in the liver. So obviously it's very important for metabolic health and energy and things like that. So the way that we kind of generally test for liver damage is with a few different enzymes that, I mean, for lack of a better way to explain it, they leak out when the liver cells are damaged and disrupted and maybe,
The enzymes will leak into the blood when the liver is damaged?
yep, they're hanging out in their liver cells. They're doing their job. They're, metabolizing different proteins and metabolizing amino acids and stuff. And then the liver gets damaged. Those cells, maybe you could just say, imagine they just kind of break apart, they just die, whatever. And all those enzymes leak out into the blood. And so we go and test for them. And there's a certain amount in your blood already. So we just kind of have a normal baseline amount that we kind of see. But if you have liver damage, then certain of these enzymes will be higher. And then depending on, sorry, go ahead.
What are those enzymes?
The most common ones that we test for is AST, ALT, GGT, and ALP. So AST and ALT, the long words is alanine aminotransferase and aspartate aminotransferase. AST is not just in the liver, it's in other cells of the body as well, like heart cells and muscle cells. So if it's elevated, it's like, great. It could be from the liver, but it could be from other stuff too. The ALT, alanine alanine aminotransferase, is a little more specific to liver cells. So if that's elevated, you're kind of more like, okay, that's liver. And then GGT is also pretty specific to the liver as well. So if you have like ALK-Phos, which is ALP, alkaline phosphatase. If it's elevated, that could be from bone and other tissues too. But if you have ALP and GGT elevation, then you're like, okay, look, we're looking at the liver. Certain of those elevations can be more prone, more due to bile obstruction. So if you have like a gallstone or a pancreatic mass that chokes off one of your bile ducts on its way to the stomach or way to the intestines, then you might get a higher amount of GGT or something like that in your blood. Others, like alcoholic liver disease, I think there's an ALT AST ratio that they look at to determine like, oh, this is most likely from the alcohol that you've been drinking. But all of it is all of it's done like with, you get to do a good physical exam, you do a good history with someone, you get like what's been going on. And if they're a binge drinker and they have, high liver enzymes, then you kind of start to paint a picture for them. So these tests are good to do, and they're giving you clues as to like the general health maybe of your liver, and then the specific reason that you may have liver damage, or the specific etiology we would talk about in the medical world, is going to be based on like the levels, the ratio between the levels, and then like good history taken by your healthcare professional. But as you can imagine, if your liver enzymes are elevated and you don't drink, and generally speaking, feel good, and you don't really have any issues, you never had gallstones and all that stuff, and then your doctor rules all that stuff out, they say, hey, look, we took an ultrasound, you don't have this, we did this, you don't have that, then you can start thinking like, well, hey, what other reasons could I have that, my liver's going wrong? And that might lead you down a different diagnostic pathway that, could really be beneficial for you. And then, you can imagine if your liver's damaged, your ability to form new glucose and store glucose is going to be impacted. Your ability to metabolize certain, chemicals in your body is going to be impacted pretty significantly. And so all of that stuff is really important to keep an eye on, most definitely.
Casey, I'm a drinker. I like to have beers and that, but I did get my liver enzymes tested in their normal levels, which I was kind of surprised. I was happy about. Talk to me about how much alcohol impacts your liver and where the concern is there.
So, I mean, too much alcohol too frequently will certainly damage your liver uh, longer and more frequently than it can like regenerate itself. So the liver is regenerative. It kind of like grows back sort of deal if you damage it. But if you damage it too often and you damage it too much, then you're going to outpace its ability to, recover. So a few drinks a week, as a young adult male that's, relatively healthy, is not going to probably cause you a lot of liver damage. But we do know that alcohol, other than maybe the social benefit of it, doesn't really have like a real strong benefit. There is some like evidence for red wine, I guess, with its antioxidant properties being good for your heart. But the alcohol itself, I don't really think there's any strong evidence that like alcohol is good for you in any
Yeah, I think
mass.
that I've done a lot of experimenting, and I am certain that it's like I enjoy drinking. I'm very social. I have fun having beers with friends, having red wine with my girl. But every single time I drink the next day, like my day is worse. I have less energy. I sleep the same amount or more usually, but then I'm not getting good rest. And so I'm, from a health standpoint, even one glass of red wine, if it does affect me, it affects my sleep. One drink, it affects me. I'm pretty certain there's no benefit for me, after testing.
Yeah, there's going to be definitely detrimental effects on sleep and other stuff. Whether or not it's actually liver damage, though, that's
Yeah.
probably not a drink here and there is probably not going to be what it really leads to chronic liver damage over time. So I wouldn't
Okay.
worry about it from that standpoint.
Okay. Gotcha. Are there anything else with the liver in terms of tests, or it's just the enzymes in the
No, yeah,
blood?
just the liver enzymes is enough to give you a good screening of how your liver's doing at that moment, I would say.
What about let's move on. Let's talk a little bit about some of your levels as a man, testosterone, cortisol levels, vitamins, deficiencies, those kind of things. Can we go into those topics?
Yeah, sure. So this is like kind of just getting a little bit more into, I would say, like aging and longevity. I would say you're kind of just, rather than prevention of disease, even though
Yeah.
certainly hormone balance and all that, I'm sure, and especially cortisol levels, inflammation in your body is definitely a contributor to disease. So I would say though, like especially with testosterone, most of that is as you get to about the age 30, 35, probably want to get your testosterone checked, at least once to get a baseline of like where you sit. Because most guys are going to be fine, but that's going to be your kind of level. And then as you get into 40, 45, 50, um, and you check again, maybe when you start feeling some symptoms, maybe you got chronic fatigue, maybe you've got some other things going on, you can tell if you've been dropping off to a significant degree and whether or not replacement would be a good idea for you. So testosterone is very, very meaningful for males because testosterone kind of boosts all the things we associate with like being a man, right? Virility, energy, strength, muscle mass, like those kinds of things are all impacted by testosterone levels. And so as they decrease with age and you start to suffer from the effects of low energy, maybe erectile dysfunction, low libido, you know, getting testosterone replaced would be significantly impactful for you, for your life and for your mental health and for other things too. I think though that one is more about how we feel, yeah, how we feel, how we perform maybe day to day in terms of like our energy levels or our muscle mass. I'm less well versed in like what testosterone levels would do for disease progression? Like, is it a risk factor for cognitive impairment? I would actually probably go out on a limb and say that it may be, but that's more from like maybe a social standpoint. But does it affect other things too? Probably. I'm not sure what chronic diseases it would affect. The hormones are all part of like the similar axis though. It's kind of starts in your brain, like your thalamus, hypothalamus, and then to the pituitary, and then the pituitary gland shoots out a bunch of chemicals that tell in males your testes what to do, your adrenal glands what to do. So that axis is all kind of connected. And so if your testosterone levels are off, the next kind of normal test is to like see if your brain is telling your testes to produce testosterone in the first place. Is it a problem up here? Is it a problem down here? And so, in concert with that, you're probably also going to check like morning cortisol levels. We know that cortisol has a sort of rhythm in the day. You're higher in the morning and then you kind of taper off during the day. And so, if you get a morning cortisol level and it's like done, like there's nothing there, then you're like, hey, why isn't my adrenal gland producing cortisol? Maybe I
Yeah,
should
and what
check
is
some levels
cortisol?
up here.
I know it's connected to stress, is that right?
Yeah, we call it the stress hormone because it's kind of like I would say it's like a stimulator in chief for like your fight or flight response. And so because of that, we use it as kind of like a general replacement or whatever for like inflammation in your body. Like if your cortisol levels are up, it's because your body is inflamed. It's fighting something, it's revved up, it's trying to do something. So either you're scared and stressed and you need to get out of a situation quick and your cortisol levels are up, or maybe you just have high, chronically high sugar levels and your body's trying to cope with all the free radical formation and the damage to your blood vessels. And so your inflammatory cascade is up and your cortisol levels are up. It's just stress on your body. And cortisol is kind of like how your body's like trying to combat the stress, or it's like, it's a general indicator of the level of inflammation and stress on your system. And so that's obviously something that would be good to probably know at least, at least once in your early middle age, right? Just like how are your cortisol levels doing and how are my adrenal glands functioning, right? How's that all?
And do you test that? Like, I mean, obviously you're stressed. Like I feel stressed at sometimes, and then a week later I might relax and not feel stressed. Is that going to change and vary a lot? Those cortisol levels, depending on how you're feeling.
Yes, they will. They will change and vary a lot. And so that's why you can't just go get a cortisol level any time of day. Usually it's in the morning because we kind of generally know that around 6 to 8 a.m. or so, that's when your cortisol levels are going to be at their peak. That's when your body naturally gives you a cortisol boost, probably to, wake you up, right? Let's get you going for the day. Let's get your body churning and moving and grooving. And so you don't want to just go and get it any old time. And then if you're stressed out or if something's going on and you go get your cortisol checked and it's super high, then that doesn't really tell you very much. You're kind of like,
Right.
okay, well, there's a bit of a confounder there. So you kind of gotta target it at the right time.
Gotcha. Okay. What about nutrition? Is there any different things we should be testing for, like our iron or our other nutrients that are in the blood?
Yeah, most definitely. So I would test for a micronutrient panel in myself, at least once a year. We were looking at B12 levels, vitamin D levels, folate levels, all of those things, they perform vital functions in our body and you just want to know that you're getting enough of them, Then for things like what was the other one that you mentioned?
Iron?
Iron. So iron and TIBC, which is called total iron binding capacity. Healthy levels of iron and healthy total iron binding capacity is a strong indicator for like lifespan in some studies. And so iron is a key ingredient in making red blood cells and binding oxygen within the hemoglobin of those blood cells. And so if you don't have iron, you're not going to be binding oxygen well, and you're not going to be delivering that oxygen to your tissues in a meaningful way. So that's definitely one that I would, look out for, especially because iron, the only way we lose it in our body is to like bleed, essentially. It's like the death of red blood cells is how we lose iron, and we don't make it. We have to have it in our diet. So if our diet is suboptimal, or you have anemia and your chronic blood loss, like in females with their cycles, they lose a lot of blood every single month, and some lose a lot more than others, and they're going to be iron deficient.
Mm.
And so, it's helpful to know those levels.
Are there individuals that have lower iron levels? You mentioned women. I'm also thinking that, and this is my uneducated brain thinking, but you get iron from red meat. Would vegans be lower on the iron?
I think that's kind of like a worry for people when they go vegan. Like, oh, how am I gonna get iron? And so certainly if you have any doctor who learns that you're vegan, they'll be like, well, let's make sure that your levels are good because you're not eating red meat. And that's the, large protein source. So you need to make sure that we're getting protein optimally, like your plant protein sources and stuff need to be optimal. And we need to make sure you're getting iron. So it's definitely worthwhile to check. I'd say that's just another risk factor for. I wouldn't say like, oh yeah, if they're vegan, they're going to be iron deficient for sure, 100%.
Anything else? Any other nutrients we should be testing our blood for?
No, I think those are the basic ones that I would recommend. I don't think there's anything else that I would really throw in there that's too important.
When someone comes to a doctor and they're unhealthy, and then they do a quick change and they change up the way they eat, the way they exercise, what are a few markers that see the quickest shift? I mean, what could you really change?
Well, I mean, like your blood sugar levels are probably the quickest shift that you would see. Like if you can change your blood sugars, hour to hour, day to day, depending on your diet and your activity levels. So I think that would be one of the biggest things that could shift relatively quickly. We check hemoglobin A1C to get an idea of what your average blood sugar is over like a 3-month period. And so
Mm.
if you come to me and your A1C is super high, and I know that like, okay, you're running high blood sugar on average day in, day out for the last 3 months at least. So if I make a change now, then I can, people wear those glucose monitors these days,
Mhm.
and they can see their sugar levels. So you can have an immediate, like, oh, I know exactly how my blood sugar is doing. And then 3 months later, 2 months later, 2, 3, 4 months later, you can get another A1C level and you'll see it come down. You'll know that it's come down because you've been watching it every day, I guess, if you're measuring your blood sugar. But for most people with like pre-diabetes, we don't have them wear blood sugar monitors or check their blood sugar every single day. We just say, look, your A1C is a little high, it's borderline. So let's just be a little bit better about your sugar intake. And in a few months, we'll check your A1C again. And if it's still going up and you've been making changes, then we need to do a little bit more like investigation into what's going on. Or maybe you're actually going into like full blown diabetes, and maybe we need to start you on a medication that can help you with that.
Is A1C the closest link to diabetes that you check in terms of a marker?
You can be diagnosed with diabetes with a fasting blood sugar level. So, like, if you haven't eaten anything for 8 to 10 hours or whatever it is, like overnight, and then you wake up and go get a blood sugar test and it's 200 or 250, that's diagnostic of diabetes. But if aside from that, then A1C is how we diagnose diabetes. It's typically like some some people say 6.5%, some people say 7% is like the official diagnosis. But if you're up there at 6.5 to 7%, you're basically at the diabetic level. Some docs I know would be like a little more hesitant to just label someone as diabetic. They might say, well, you're pre-diabetic or you got some metabolic syndrome, but that's easily taken care of. Maybe their diet is just really bad, and it's been really bad for a few months because their spouse passed away and they just stopped caring. So I think most of us would say, let's get this level, let's optimize your lifestyle, and then let's get another one in a few months' time. And if you go back to like normal levels, I'm not just gonna like throw diabetes on your medical chart. I might say you're pre-diabetes or you're like got metabolic syndrome of some kind. Some doctors are just trying to be more accurate. They're trying to be very careful in how they paint people because you can just kind of get labeled with certain diseases. Yeah, but A1C and like fasting blood sugar is how it.
Okay. Well, we've covered a lot, Casey. I just got a few more questions here. First one is, if you could only run 5 to 10 tests on someone, like the main ones, someone not that you have any symptoms, they seem like a pretty healthy 40-year-old man, what would those main ones be if you want to maximize your lifespan? And, let's say you wanted to, if living to 100 is your goal, I want to start testing these things in you at 40 years old, what would be the main things you'd look for?
I would do a complete metabolic panel, which is going to be liver function, kidney function, electrolytes. I would do a complete blood count, which is your hemoglobin, or red blood cells, white blood cells, and the breakdown of your white blood cells. That all comes together with that. Then I would do lipid panel, hemoglobin A1C, thyroid study, TSH, probably more than 5, honestly. I would do, yeah, CMP, CBC, hemoglobin A1C. I would probably do, man, if living to 100, I guess I would do an iron. No, I don't even know that I would start with iron and TIBC because usually in a healthy 40-year-old guy with no other reason to suspect iron deficiency or something, they're usually pretty okay. I might wait on that one. I might get a micronutrient panel just to make sure there's no glaring stuff that's like, oh my gosh, like you're really not getting enough vitamin D, like you really got to, step that up or what's going on there. Certain things like vitamin D is one of the fat soluble vitamins, so if you have something like irritable bowel or malabsorption, it can be an easy way to be like, oh, look, you're not getting vitamin D, but you eat plenty or you're taking a supplement. So let's look into that a little bit more. So those are a micronutrient panel along with those other ones is probably the ones that I would recommend. And then just the next step up, I'd probably do the iron panel and the polyunsaturated fatty acids and the inflammatory markers like CRP, called C-reactive protein, and interleukin 6, IL-6. Those I think are a little, for the people that are interested, could give you a nice little baseline of like, how inflamed am I and how am I optimizing my fatty acid levels to promote, and how does I say this, not promote an anti-inflammatory state, like keep my inflammation down, right? I want to make sure the levels aren't up. I want to make sure my CRP is good, and then I want to make sure that like I have enough of the good stuff around, like omega-3s and the right ratio to omega-6 that keeps that environment healthy and keeps my inflammation down. You know what I mean? So those are probably, yeah, that's probably where I would start.
What would you think that would cost an individual without insurance if their insurance doesn't cover it, to get that test?
Probably a few $100, I would say. You know,
Okay.
anywhere between like $100 and $300. I think most labs would probably have a cash pay price like somewhere in that ballpark. I'm not 100% sure, but it's probably about right.
Is that per panel or is that
No, I think
total?
like to get all those tests done, you'd probably be spending on the order of like $100 to $300, just yeah, out of pocket.
Okay. Are there any big mistakes that people make when they do get blood tests? Anything that, hey, you shouldn't be doing that?
I've not heard of like many where I would say, "Oh, you shouldn't have got that blood test done. You had no reason to, and now we're stuck with this like blood test." But that's generally with all blood tests. It's like if you don't have a reason to get it, if you get stuck with an abnormal test, what do you do? Now, all of a sudden, now you got an abnormal lab test. Now you've got to go get like a workup done,
Mhm.
figure out why that's abnormal. So, for someone who's generally pretty healthy and doesn't have any real reason to suspect chronic inflammatory disease and they're not really interested in health and longevity and maybe they're a bit of a nervous Nelly, like they're not real responsible with gathering info and they can't just kind of make a reasonable decision. I don't know that I would go and get inflammatory markers just to get them, and then they get them, maybe their inflammatory markers are high and now they're worried that they have some autoimmune disease and now they want double-stranded DNA to check for lupus and they want the rheumatoid factor to check for, rheumatoid arthritis and they want all these things, but those things can sometimes have false positives, like you can have a false positive for just about any test under the sun, and then what do you do with that information? So it kind of just depends on the person and the reason that you're getting things done. But for the most part, if you just stick to the basics, and then depending on your level of interest and responsibility, you go on to some of these other things, then I think you're safe.
That's awesome. Casey, are there any other things that you want to say that I haven't asked you about for a blood test?
No, I think we covered basically everything. I think, the long and short of of wellness and health and longevity is that you want to make sure that your body's in an environment that promotes long lifespan and abundant health span. And so checking for the basic things like cardiovascular health, metabolic health, levels of inflammation, and then making sure all your organs are working, right? So you're checking liver, kidneys, and all those things. Those are the basics of it, you know? And so I think as long as you're getting those basic things done, you can always move on to, DNA methylation, right? And get your chronologic versus your biologic age for the people
Mm,
that are really interested in those things. I think those are really interesting and really cool.
yeah.
But for the lay person, I don't know how much it affects their daily life, right? I think sometimes, maybe if you found out that your biologic age was much greater than your chronologic age, you'd be like, "Oh my gosh, like I need to take some steps to do some anti-aging." But those are, probably pretty costly. I don't know the exact prices of those kinds of things. And it's just information that right now we would be recommending those things to people anyway, right? Like without knowing what your DNA methylation ratios are and pattern is, I would tell you need to exercise every day. You need to eat a healthy, balanced diet, and you need to make sure that you're monitoring for and controlling chronic illnesses when they pop up. And if you can do those basic things, you're going to be doing what you need to be doing. But yeah, for those of us that like are interested in it and want to get a few more things done and like kind of want to understand our bodies to that greater amount, I don't think it's bad to go and get some things done right within reason. But for most people, the basics are good enough.
Casey, talk about your chronological versus biological age. And I have this Garmin, and it was a gift, and it's one of the best gifts I've received because
Yeah.
I do a lot with it. I track my sleep, which I'm very interested in what my score is. I track my exercise sometimes, but it also gives me the physical age I'm at. So I find it fascinating. How accurate do you think this is?
I'm not 100% sure on the device side because it's probably measuring something like your metabolic output and like I don't even know if it can measure your VO2 max or something with those
Yeah,
devices.
that's
Sometimes
what
they
it
can,
says.
right? Like yeah, it'll measure your oxygenation in your blood and stuff like that. VO2 max I think is a great indicator of general cardiovascular health. I think it's super helpful for the lay person to know your VO2 max. I'm not sure what it does for them, but for people who are interested in it and who want to make sure that they are operating at their like optimal level. For me, I have two little kids and I'm coming up on 40 here in the next year or two. I want to make sure that like I can lift my kids up and play with them and take them out. And so like I'm a little more interested in things like that. Maybe I should get one of these Garmin guys and like make sure my VO2 max is where I want it to be,
Yeah,
especially because we know that cardiovascular health, to get it optimized, it takes a little bit. You can't just go work out once or twice and all of a sudden you're optimized. Like you've got to have sustained, effort. And for someone like me who maybe doesn't do enough aerobic activity, that would be really helpful. So the device side, I'm imagining that's probably where they get their data from. And I think it's useful for people who want to utilize the knowledge to like better their life or better their situation. But the DNA methylation stuff, like the biologic versus chronologic age, I think is more for those who are really interested in trying to really dial in where they are from a biologic cellular standpoint. I think it's very interesting. And the long and short of it is essentially your DNA has methyl groups attached to it, and usually it's to silence gene expression or to control which genes are allowed to be expressed. And so if you have too much methylation or in the wrong spots, you might suppress a gene that fights tumors, right? You might suppress a tumor suppressor gene, and that's not good. So there are some companies out there nowadays that can look at your DNA, see where the methyl groups are via science, labs and science, and then they can look at the pattern of where they are on the genome. And so they can say, like, generally speaking, with this pattern, this is a good pattern to have. The genes that, you know, need to be active are active and the other ones aren't not. But there's other patterns where they know, hey, like you got methylation in spots that are going to suppress some advantageous genes. And so that's not going to be good. And through that algorithm, they have their own little study. They give you this, like, they churn out a little number for you. Like, this is your actual biologic age. And
Hmm.
I think that's just a measure of, how long are we expecting you to live essentially. I don't really know how they extrapolate it, but pretty interesting. I think with
Yeah,
with the device that you carry, that you have on your wrist there, the Garmin, I like those kinds of things. I think the DNA methylation is super interesting, but I don't know if it's quite as actionable maybe as like, oh, I need to get my VO2 max in a better place. I need to go do some
yeah.
more aerobic activity, and I think that's a little bit more actionable for the lay person.
You know what blows my mind about this thing is I'll wear it when I sleep and I wake up and within like it will give me a score within between 1 and 100 and that's the score. And I probably can guess within like 1 or 2 points, 1 to 100 of like what my sleep score will be. It is so accurate to how I feel. And I'll actually do
Wild.
that. Like I'm like I want to guess it before I look at it just based on how I feel and it is so accurate somehow and I'll always realize like even if I have 1 drink or 2 drinks, it will
Mhm.
decrease by 5 or 10 points. If I have 5 or 6 drinks, my score sucks. But it is so accurate and it's awesome. We should actually do a podcast on, like, wearable at home
Yeah, I
technologies.
think that's super cool, and that's really cool because it gives you actionable data where you're like, I'm noticing when I drink at this time of night, my sleep is significantly affected, and I
Yep.
just like it's affecting my work performance, it's affecting this, and so I'm gonna choose not to drink during the week or whatever it is. And I think that's awesome. That's like it's so impactful, it's so meaningful for people on a day-to-day basis. I think that's really cool stuff.
Cool, Casey. Well,
Cool.
so good to see you, man. Thanks so much for doing the
Same.
podcast, and maybe we'll do this one next week with
Yeah.
the wearables.
Yeah, let's do it. Let's go get some labs.
Yeah. All right, man. Thanks so
Cool,
much.
dude. Nice to see you.
Bye.
Yo. Uh-huh. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel.